Today we're sitting down with Dr. Arianna Brandolini. Arianna is a Harvard-trained psychologist based in New York City who specializes in treating OCD, anxiety, depression, and other trauma-related disorders. Over the last couple of years, she's gained a considerable following online for helping people through relationship anxieties. In this conversation, we talk about the full spectrum of mental health issues that are plaguing our society. We discuss the power of self-awareness and emotional intelligence, in addition to the origin of negative thoughts and the importance of a diagnosis. We then turn our attention to dating, relationships, and attachment styles while helping you wade through some of the toxic behaviors that exist on dating apps. As you'll learn, self-awareness is a starting point to emotional health, and for that reason, we believe that listening to this conversation is one of the more important decisions you can make for your mental health. So without further ado, Dr. Arianna Brandolini. All right, Arianna.
Hi.
Nice to see you. Thank
Good
you
to
for
be
coming in
here.
today.
Yeah, thanks for having me.
So yeah, we were talking about your education. So you originally got your education at Harvard, and obviously a lot of people know that Harvard has like the lowest acceptance rate in the world. Obviously produced a lot of brilliant minds, and so what was the experience like going there?
It was awesome.
Yeah.
It was awesome. Yeah. I think what was really, you have these incredible professors and incredible minds that are very famous, which is very cool. But I think what makes Harvard really special is the students. I remember it was like my first week there as a freshman, and I was doing laundry in the laundry room, and there was this girl, and she was practicing the violin as she was waiting for her laundry. And I was like, wow, she's really good. And then I learned later that she's like tours internationally with like, this orchestra. And so you just don't know the student that's sitting next to you is like extraordinary in many ways. And so that was really cool.
Yeah.
Yeah.
Was there like, did you feel like a sense of competition at all, like at Harvard, or not really?
There can be if you want to engage with that.
Yeah.
But like, I think there's sort of a large percentage of the population of the students that are very studious and probably pretty competitive. But then there's like maybe the 20% that sort of parties and is, not necessarily as competitive.
Yeah.
And so I think you can kind of choose where you want to sit in that.
So what led you then to become a psychologist after school?
When I graduated, I was in an identity crisis for about 6 months, traveled to India. I was like, oh my gosh, what am I going to do with my life?
Wow.
It was extremely stressful. And so then I like tried all these different things like TV and advertising, and I didn't like it. And so then my academic advisor from Harvard called me, and she's like, listen, why don't you come back? You can work in my lab as a research assistant. And it was under Richard McNally, who's, a big trauma guy, well-known name. So she's like, why don't you work part-time in my lab? And then part-time, I can get you a gig at McLean Hospital.
Oh, wow.
And so at their OCD Institute. So McLean Hospital is a very well-known hospital in Boston. They had an entire residential program for people who suffered from obsessive compulsive disorder.
It's like one of the top mental health hospitals in the country, right? Yeah.
It is. It's Girl Interrupted is based there, the movie.
Is that with
Winona
Angelina
Ryder.
Jolie?
Mm-hmm.
No? Okay, yeah. Yeah.
And so, and the OCDI at McLean was one of the few places where you could have interactions with patients with just like an undergraduate degree. So you kind of ran the unit as a community counselor. So you ran groups and people lived there. So you would, make food with them. You would implement kind of the behavior plans that their therapists and psychologists would come up with.
Yeah.
So it was really great training. Like I got kind of a lot of OCD expertise, which is a very specific type of treatment that not a lot of people know about or are trained in. And so, my academic advisor was like, why don't you just see if this is something that you would like to do as like a psychologist? Like you're good at this stuff, you like it, why not? So I was like, okay. So I went and I did that for about 1.5 years and then decided to go to graduate school.
Yeah.
Yeah.
So how many years have you had your own private practice now?
7 years, I think.
7 years?
Over 7 years now. Yeah.
What is your opinion on like mental health and after all these years of doing it and just the field and like working with people?
I love it. I absolutely love it. And I never thought I wanted to do private practice. I
Yeah.
actually thought I wanted to do other stuff. For my residency, I worked at the Manhattan VA and different hospital settings and community settings, and I loved that. But I kind of got pushed into private practice, and I wasn't sure I'd like it. And I actually really love it. And so it's awesome. It's like an honor, you know. I struggled with a lot of different professions because I think for me what's really important is feeling like my work is meaningful.
Yeah.
And because this has always just been my personality, my bent in terms of helping people.
Yeah.
My mom tells a story, I was like around 5 years old. And she walks into the kitchen and I was giving my babysitter relationship advice. So I was just destined to do this stuff.
Your babysitter.
Yeah. So it's just, it's awesome. It's, I think you have a sense of responsibility to kind of, you're in a position to really impact someone's life, right? And so I think that there is a sense of awe and responsibility to be like, okay, like this person's trusting me in a moment maybe of intense pain, of intense confusion, and they're coming to me to actually help walk with them through this to find a path forward.
Yeah.
And so, it's like a huge honor. And so I'm really humbled a lot of the time,
Yeah, I mean, not all psychologists obviously can be all things to all people, but what I love what you've done with your education and practice is kind of like how well-rounded you are in like multiple different areas. And so I kind of want to kick it off by talking about cognitive distortions because of how much of a negative impact they have on people. I think a lot of people haven't heard that term before. They may be vaguely familiar with it, but when they think, oh, I have a lot of negative thoughts, they don't realize that what they're actually talking about is cognitive distortions. And so I think it doesn't really matter who you are, like whoever's listening right now, like probably struggles with this to some extent. I saw something, I don't know if this was recently that you posted, but the data is all over the place, but it's estimated like we have 12 to 60,000 thoughts a day or something like that. And 80% of those are negative.
Yep.
And so a lot of those thoughts are cognitive distortions. Why do you think we have so many negative thoughts?
If there are different theories on it, if you kind of look at it from like an evolutionary perspective, a lot of people believe that we're one of the main drives as a human being is survival, right? And so, in a modern world, it's hard to conceptualize, but if you conceptualize it before when there were a lot of physical dangers and, food was scarce, and so you had to really fight to survive, you have a negative valence because that's the most important stuff to pay attention to, right? And so, I think that jives in a lot of ways. I think we also live in a fallen world with a lot of issues and a lot of difficulties, and so I think that that kind of force pervades.
Well, yeah, I mean, you have the evolutionary thing going on, and then kind of what you're alluding to. Do you feel like the presence of the state of the world and like our circumstances obviously amplifies certain of them? I mean,
absolutely.
Yeah, so.
Like we all have filters through which we see the world, right? Yeah. All of us. I have filters, you have filters. Some of them are healthy and good, but plenty of them are also unhealthy and not helpful, right?
Yeah.
And the way that we develop these filters are different ways, right? So there's genetics. So, maybe your family has a genetic bent towards depression, towards anxiety, towards certain ways of thinking. There's your personality. You can be born in the same family and have a very different personality than your siblings, right? You can be more neurotic, you can be more laid back, but a lot of it is based on your experiences, right? With your caregivers, with parents, with teachers, did you experience trauma? Did you experience lack? Did you experience love? All these different things actually shape the way that you see the world. The way that our parents responded to situations gave us truths, right, quote unquote, of who we are and how the world operates around us.
Yeah.
And so, we get to a point where part of why I love what I do is because I think in order to live healthy and free, it's really important to examine a lot of this stuff and be like, wait a minute, I keep having problems in this area, or I keep having reactions in this area. This area of my life is not what I want it to be. Why? Why is that, right? Are there belief systems that I'm operating out of? And so the good news is that our brains are really plastic, meaning that they're really malleable. And so those filters and negative automatic thoughts and cognitive distortions are part of that, right? They're kind of clues to the deeper core beliefs that we have about us or the world.
That's good.
And so being able to examine that stuff, you can actually change it by rehearsing something different, and I do something called cognitive behavioral therapy, and so we talk about it as reconstructing a thought, right? And so that's why I think it's so important to be able to have that awareness of what those thoughts tend to be, and then how are they impacting your life, and how do you actually change them?
Yeah. So just very simply, can you define what cognitive distortions are and what makes them problematic?
Basically, cognitive distortions are distortions in perspective of a certain lived experience, right? And these distortions are unhelpful and problematic in terms of how you relate to the situation and in terms of how you behave as a result of it, right? And so, what was the second part of your question?
What makes them problematic?
Well, exactly that, right? We operate out of our belief system, right? The way that we behave is rarely just because of nothing. Even our emotions come from somewhere, right? And they usually come from a thought that is so automatic, that is so sometimes subconscious. All you do is feel a feeling and react out of that place, right? And so actually slowing ourselves down to be able to examine what that thought is important, because cognitive distortions influence how you behave in the world, and they're going to influence how successful you are in the world. Because you can either behave in a helpful way or you can behave in a really unhelpful way, right?
Yeah. So there's around 15 cognitive distortions. So I want to break some of them down. You recently did a post on all or nothing thinking. So what is that? Or it's also known as black and white or right thinking as well.
Yeah. So, and as you said, we all do these things. We all have these tendencies. And what I think is helpful having them labeled and in textbooks is that it actually shows you that you're not alone, and this is something that a lot of us do. And so one of the big ones is black and white thinking, which or all or nothing thinking, which basically means it's along the lines of something is perfect or it's terrible, right? There's no gray. There's no kind of that was pretty good, or that wasn't great. And so when you're stuck in that kind of, this is either all one thing or it's all another, which is not really how the world works, right?
Do you have an example of a thought or some situation that people might find themselves in?
Yeah, it's kind of I talk about it a lot with work, right? That if you don't do a presentation or something, or even at school, something perfectly, then it's terrible. Right? And people get really disappointed. Oh, I got a B, right? And they're like, oh, that was awful. And it's no, actually that's, can we look at the gray here, right? Even in a presentation or, a date, either it has to be amazing or it was a failure. It was awful. It was just devastating, right? So it can be seen in every single area of life, and it's usually kind of that perfectionism, right? It has to be perfect. Otherwise, it's absolutely awful, as opposed to living in a state of most things just need to be good enough. Some things need to be really excellent. And so it's important to expend energy on the excellent. If you're doing brain surgery, you must be excellent, right? If you have a big presentation for lots of clients, okay, you must be excellent. But otherwise, good enough is actually where a lot of success lies.
Yeah, that's good. Yeah, I think another one is mind reading, and I feel like everyone struggles with this. It's just like,
Yeah.
oh, what is Arianna thinking right now?
Yeah,
Like,
absolutely.
And then like you're basically like crafting a story in your head about what the other person is thinking. And then the worst part of it is like you're living as if it's true.
Yeah, absolutely.
And so there's a balance with that one of like having to deal with like uncertainty and some like, cause you don't know what someone's thinking truly. Absolutely. I mean, you can discern from their body language.
Yeah.
And so can you talk about that one a little bit and like what you've seen with your patients with that one specifically?
Yeah, ultimately, how I like to describe it is that you're basically you're projecting your own mind onto somebody else, right? So when they're like, oh, this person hates me, I'm like, no, you're thinking that maybe you hate you or this person hates you, and you're actually projecting it onto this person. You have absolutely no idea what they're thinking, right? So it's actually more about you than it is about the other person.
Yeah.
And so, I think it's a really good one to be able to examine ourselves, because oftentimes what we project onto someone else is an assumption that we're making, right? And usually those assumptions are not positive. They're usually pretty negative, right? And so being able to actually slow ourselves down to be like, I actually don't know what someone else is thinking. It helps you either let it go and be like, as you said, you have to tolerate the discomfort of not knowing because you're never going to know fully. Or it actually forces you to practice communication. It forces you to say, I actually need to ask someone to clarify.
Clarify assumption,
And especially in like relationships, that's really, really important, right?
Yeah.
And I often say, don't assume anything. Always ask. There's no such thing as over communication.
Yeah.
Right?
I think where it gets difficult or like, so you could see clear issues with what you're talking about. I think that it kind of blends in the area of like reading someone's body language. And so I think that in a sense is helpful to like navigating the world around us.
Yeah.
Like I'm looking at you and your body language is like completely uncomfortable, or you look angry or sad. And I think, we're going to talk about dating later, but a lot of people, like when they're going on a date with someone, they're trying to figure out how this person feels. And you might get into this awkward place of like, you don't want to like put yourself out there. You don't want to put yourself out there in work. You don't want to put yourself out there in dating. Like there's the like the rejection type element of it. And so like the only thing you really have to go by, unless you're going to like be upfront and have communication, is like the person's body language.
Yeah, sure.
And so how do you like interface between kind of mind reading and then just navigating the world through people's body language?
I think what cognitive distortions, I think what you're saying is totally accurate. And when we talk about cognitive distortions, it's more about an unhelpful pattern of thinking, right?
Yeah.
And so I think being able to read someone and have emotional intelligence in terms of figuring out, okay, I can kind of intuit, maybe I said something that made someone uncomfortable. Maybe this person's having a bad day, right? But mind reading is often believing absolute truth. Oh, this is what they're thinking, and I believe that, as opposed to holding intention. Okay, this might be happening, but I also don't know for sure. So I think it's sort of that tension, right? I think with mind reading, it's often like an absolute truth that you believe and that causes a lot of anxiety and stress, and that isn't helpful, right?
Yeah.
Whereas being able to read people's body language and being able to kind of discern things is actually a very helpful and good skill to have. And I think people who are good at it also know this isn't absolute truth, right?
Yeah.
I could also be getting it wrong.
True. Yeah.
Someone might be having a stomach ache, or they might be having a bad day, right?
Yeah.
But so I think that's also healthiness, right? Not holding things in absolute truths all the time.
That's really good. Yeah, another one is emotional reasoning. And so it kind of, I like to say, like, you could, if I feel it, it must be true.
Yeah, absolutely.
And so I feel like that is kind of paints a picture of our culture right now of just anything that I feel like in a given moment must be true. And so how do you work through that with like patients?
Yeah, I think, this is, a lot of it is also learning about your emotions, right?
Yeah.
And the role that they play in your life and how you can use them for information, but don't let them run the show in anything, right? So with emotional reasoning, yeah, people often are like, I feel lonely, therefore I'm alone, right?
Yeah.
Or I feel sad, therefore this is bad,
Yeah.
right? As opposed to recognizing that our emotional states aren't always accurate to the situation at hand.
Yeah.
They're more actually information about us and how we're doing and what's going on within us. And so, I think a lot of that is learning about your emotions and what they look like and how to work with them well, how to process them well. Our emotions are a gift. They absolutely are. But, there's also a healthy balance in how much you operate out of them, right? So, an emotional reasoning is a big one. It's like, if I feel it, therefore it must be true, as you said, and that's not accurate. And you also don't live a good life if you operate that way.
Yeah. Yeah, I think it's a really interesting conversation in terms of like how to view your emotions. And we had a previous episode with Dr. Anna Lemke. She's a addiction medicine specialist at Stanford, and we were kind of just talking about like the kind of happiness narrative of our culture of like, I'm not so certain that like our parents and grandparents' generations like put so much weight on the way that they feel in the sense that our generation does.
Yeah.
And so kind of coming from a psychology background, why do you feel like people struggle so much with their emotions?
I think that's a nuanced question for lots of different reasons. Some things in terms of what I believe. I think, especially in Western culture, I think we see this a lot where it's very individualized.
Yeah.
And so it's more about we are the priority, I'm the priority versus the whole, versus like the family or the community. And so as a result, if you focus too much on yourself and too much on your emotions, they end up ruling the show, and you believe that these are of the utmost importance, right?
Yeah.
How I feel is of the utmost importance. I think we also don't necessarily do a good job of, I think it's getting a little bit better, but sometimes we don't do a good job of actually teaching kids or teaching people how to manage their emotions well. And in the age of kind of social media and things that are also very self-focused, it's about you, it's about you, it's about you, it's about me, it's about me, it's about me. I think that's a big part of it.
That's good. Yeah. So, I mean, it's like, then it causes you to, I guess, outwardly act out of that place if it's like everything is about my feelings and my emotions and how things are making me feel in terms of like what's beneficial for like a family unit or a friend group or like the group of people or I don't know, people around you at large. So
I think that there's a different bent, in terms of the focus, right? It's more on the individual and so I think that's a big part of it.
Yeah. And then some other ones, are just kind of overtly negative in a sense, like fortune telling, like people's, trying to predict the future or living as if they can predict the future and know exactly how like a situation is going to go, or catastrophizing,
that's a big one.
mental filtering. So kind of like filtering out like negative, like all the positive aspects of a situation and only fixating on the negative.
Yeah.
So I feel like a lot of people can resonate with that. And I think cognitive distortions in general, the risk is that we could start living in just like unreality, and like create a world that doesn't actually exist. And so I think for the struggle for me in this conversation, just very personally, it's like, it's important to quote unquote take these thoughts like captive and kind of measure them against what's true. But it doesn't always feel intuitive or obvious, like to do that. And like sometimes you find yourself in these kind of negative, like automatic thought loops for like minutes or hours.
Yeah.
And like sometimes you don't even realize that it's like going on.
Yeah.
And then you're like, and it's just kind of like you're in a trance almost.
Yeah.
And then it's like an hour and you're like, whoa, like I was just like thinking about that for like an hour. And so why do you think it's so hard to be aware of your own thought content and then just kind of like be like present with it in the moment?
Yeah. We weren't really designed to think about our thinking, right?
Yeah.
We were kind of designed to just operate in the world. If we're constantly thinking about what we're thinking, we're never going to get anything done.
Yeah.
And so our brain is like a supercomputer that shortcuts all over the place to be able to help us behave efficiently.
Yeah.
And so, as I said, usually what you see is your emotions and your behavior, right? And so it takes... It's sort of like a skill to learn how to slow yourself down enough to be like, whoa, what's going on? What's going through my brain, right? And so that's why, we've been talking about kind of individualism and that being a lot of Western culture. I think that's why it's so important to actually have people in your life, right? Yeah. It's actually important to not be alone with your thoughts, because otherwise you're in this echo chamber and there's no voice of reason being like, wait a minute, whoa, what are you talking about, right?
Yeah.
We kind of need checks and balances in our life to be able to help us determine what is real, but also what's helpful, right? So often I say to people, I'm like, is that thought true?
Yeah.
Even if it's true, is it helpful?
Yeah.
Right? And so, actually being able to recognize that you have blind spots, recognize that you do have ways of operating that you might not even realize are unhealthy. To you, it just feels like truth, right?
Yeah.
It's like, and so being open to having people and avenues in your life where you're able to have someone speak into that stuff, right? And to be able to help reality check for you, whether it's faith, whether it's friends, whether it's community, whether it's therapy. Yeah. There's many avenues to do that. And that's why, we're not meant to be alone. Yeah. Because, us with ourselves can be a disaster.
Yeah. Also made me think about body image a little bit, about like how you could look at yourself in the mirror and be like, oh my God, I'm just so ugly, or something like that. And how the perspective of another person to like come into that situation, it's like, it's almost like you have just a completely different lens into reality of like, absolutely. I think this thing about myself, and then someone else is looking at me or looking at that person, and they're like, oh wow, they look really good. They look really like handsome, beautiful, or something like that. And I think sometimes you kind of need another person to come in and help you with that. Yeah.
And it doesn't mean you believe it right away, but it actually, at least it gives you a signal to be like, whoa, I actually have this thing and it's not good or helpful for me in my life. What am I going to do about it?
Yeah.
Right.
That's good. Yeah. I mean, so kind of the reason why I want to talk about cognitive distortions first is because like, I feel like you need to have a baseline understanding of that to become more self-aware. And you called self-awareness the cornerstone of emotional intelligence. And so,
dun, dun, dun.
So why is self-awareness so important?
Well, self-awareness is foundational to be able to operate optimally in the world.
Yeah.
Meaning to have good relationships, to be successful at your job, to be healthy, right? Because if you're not aware of how you behave and how your behavior affects others and impacts the world, then you're never able to actually modulate, change it, modify it for the better. And so, being able to examine all that stuff helps you be better able to, not only have better self-worth, better self-esteem, but also it impacts how you operate and change the people around you and, every single area of your life.
Yeah. Yeah. Obviously the challenge is like kind of what you said before of like, it doesn't intuitively come natural to us.
No, some people are better at it than others naturally, but it's work.
Yeah.
It's work.
Yeah. So then what is emotional intelligence then? How would you define that?
I mean, I would define it as basically, how aware are you of your emotional state? How well are you able to manage your emotional state? And how aware are you about other people's emotional states?
Yeah.
And how are you able to relate to them in that, right?
Yeah.
So it's kind of being able to recognize and manage your emotional state to be able to operate in a healthy and productive way. Right?
Yeah. I think for me personally, it's like, I can recognize, I guess what you would call a surface emotion.
Mm-hmm.
So it could be anger, but there's like deep roots probably to anger or anxiety.
Sure.
Do you see that like with a lot of your patients of like they're in some way self-aware of, I feel anxious right now, but then not really understanding like what the root cause is of that?
Yeah, absolutely. And I think this is for all of us. When we have a strong emotion, as I always tell people often judge a lot of their emotions as bad or good. And I'm like, emotions are.
Yeah.
They're not good or bad. They're information about something that's going on.
Yeah.
Right? And so being able to approach this with curiosity and be like, I'm feeling really angry. What does that mean? Right? And certain emotions will mean certain things.
Yeah.
Sadness might mean loss or grief. Or feeling trapped, right? Anger might feel like there's an injustice that's been had, or that you feel diminished in some way. Anxiety can mean all sorts of things. It's often a numbing agent, right? If you're like, sometimes anxiety can be used, and anger too, can be used to mask deeper, ickier emotions like shame. Again, I think that there's people who are naturally pretty good at it, and there's some people who just need coaching. They need coaching in terms of how to examine your emotions and how do you actually use them in a healthy way. How do you manage them if they're overwhelming, right?
Yeah.
There's lots of stuff to it.
So what do you feel like the starting point to self-awareness is then? For just the average person listening that may or may not be going to a therapist right now.
I think the start is recognizing that there are areas in your life that you have blind spots.
Yeah.
It's recognizing, I probably have areas where I operate in unhealthy ways and unhealthy belief systems. And so I think that starting off with curiosity is extremely important to be able to be curious about that stuff. Along with that, to actually start doing it, I talk a lot about the importance of slowing yourself down to be able to actually start to evaluate what's happening, right?
Yeah.
So I talk a lot about things like mindfulness, and even on my website and stuff like that, I have all these resources that people can access to start to slow yourself down to ask yourself questions, right? I often say, I don't want you to react out of anxiety, out of fear, out of emotion. I want to help you learn how to respond out of your values despite feeling an emotion. And so I often say that emotions are like children. You don't want them driving your car because they will crash it.
Yeah.
You don't want to shove them in the trunk because they might die.
Yeah.
You want them in the back seat where they can be seen and heard and attended to, but they're not in control of anything.
Yeah.
Right? And so what is your emotion? If your emotion's screaming in the back, what is it telling you?
Yeah.
What do I need right now?
Yeah. Yeah, obviously the kind of flip side to that is like the harm of like, you could put so much weight in your emotions, or you could like completely suppress your emotions.
Exactly.
And just like push them down.
Yeah. And so, as I said, emotions are a gift. They're part of what makes us human. They're really important because they're clues as to what's going on. Like, if you're feeling something, maybe there's something you really need, and you need to attend to that, right? To be healthy. And, we talk about processing emotions, and people are like, I don't even know what that means. And to me, processing emotions is literally just allowing yourself to feel them.
Yeah.
And if you look at research, emotions don't last very long. Emotions are like waves. If you let them happen, they will move through you. And that's kind of what processing looks like. It's allowing the emotion to happen without suppressing it, without trying to change it, without trying to ignore it. And maybe without trying to indulge it too much, right? It's allowing it to be there. So emotions are awesome, but having a healthy relationship to them is important.
Is that true, like universally for, I mean, we're going to talk about diagnosis in a minute, but like, is the idea of an emotion just kind of being temporary or moving through it? Is that true for OCD? Is that true for clinical depression? Is it true for like just the average person, or is that just for some people that because it feels like for some it would last longer than for others?
I think that's, It's been a while since I saw that study, but no, if you have kind of clinical diagnoses, the reason why someone, has something, we call it disorder, it just means that it's disordered. It means that it's not functioning as it optimally should be, and so I think that even with emotions, there's reasons why, whether it's biological, whether it's, because of something that you're dealing with, whether it's also because you've developed very unhealthy habits that things get stuck, right? And so, there was a study that showed that, again, emotions only lasted a certain amount of time, but then there's stuff that we do that can maintain it and that can keep it going.
Yeah, keep it going,
Yeah.
Yeah, I mean, one of the things that I learned through therapy is just even the presence of that negative thought or the emotion. If we're like, to your point, if we're looking at it like, I don't know, I'm on an airplane and the flight's going to end in an hour and then I'm going to be like on the ground. If you look at your emotion that same way, that it has like a time limit to it, it makes it a lot easier to withstand the pain of that emotion in the moment.
I love that.
Of like, I'm not always going to feel this way.
Yeah.
But I think the tendency or struggle at times, obviously, is to not believe that and then be like, oh, this is just going to last. And then you just like really get in a hole because it's like, I don't want to feel this right now. It's painful. And then you kind of just start medicating or like distracting yourself, emotional eating, I don't know, whole wide range of things.
Yeah. I had a supervisor a long time ago who said to me he actually believes that most of mental health issues happen because of the avoidance of pain. And I think I found that a lot in terms of how, in working with people, that if you look at the whole spectrum of human emotion, half of them are negative.
Yeah.
Half of them are not fun.
Yeah.
And I think there's a fear often of feeling these negative emotions, and it's like, I can't handle it. I have to get rid of it. I can't do this. And that actually ends up perpetuating it. It ends up, we develop unhealthy habit. It's not good, right? So it's actually learning how to radically accept the fact that you are going to have some emotions that really suck, right? I often talk about making anxiety your friend and being like, okay, he's here for the day. Come along. Try not to get too close, but here you are, right? And actually, when you're able to not avoid it, as you said, you also figure out, I can actually handle this. And then you come to recognize that, as you said, this doesn't last forever. I'm not going to feel this way forever. And so, so I love that analogy.
I feel like that's the key to almost resilience or greatness of developing a character and stuff. I mean, it's especially relevant to dating as well. Because let's just say you like someone and they don't necessarily reciprocate that feeling. And it's just like, oh God, I just feel terrible right now. Like, I just feel so terrible about myself. And like the last thing you want to do is like you're accepting that, like, okay, they don't like you, they just rejected you. And then on top of that, you're like, oh, okay, let's sit with this feeling now of like, and it's just like really,
it's really hard.
Yeah,
it's
really hard.
Not easy, And so, again, that's why, I don't think we need to do this stuff alone. I think having people to encourage you to be like, yeah, you can do it. All of that management isn't just yourself. It's also meant to be in community. For people, when you find it hard to do it for yourself, you need encouragement. You need people to be like, you're amazing. Stop it. It will be okay. It's important.
Well, I mean, so what role, like, I was going to talk about this later, but what role do you feel like therapy plays in this? Because, I feel like there's a much more positive cultural perception of therapy than there was 20 years ago, 30 years ago, especially 50 years ago. I mean, and even if you look at studies, it's like, I don't know, 4% of boomers went to therapy. And now it's like, I feel like Generation Z is like teens, like early 20s are much more open to this stuff. But I think what's weird is when you look back on human history, it's like therapy or psychotherapy, I think got introduced maybe in the 1800s. So you have an entire like thousands of years where like we did not have therapy and we were still having to deal with all these things. And so like, what role do you feel like therapy should play in people's lives?
Well, I think part of it is also, as we were talking about, right, that modern life has evolved to something that hasn't, isn't recognizable from what it was, right? We don't really live in the communities, in the structures that we used to. And again, it was also safety in numbers. It was safety in community. And so, people might not have had a therapist, but maybe they had a mentor. Maybe they had a rabbi. Maybe they had a priest. Maybe they had an older brother or sister. So I think that, I don't think therapy is suddenly the culmination of like, we figured out things that, are now going to change and revolutionize the world. I think it's just another manifestation of something that's been around for millennia, of having wise counsel, right? And so in a Western culture especially, where people aren't living in communities, where people don't have, elders in their life to help them, we have something called therapy, which is awesome, So I don't think therapy is the only way to heal. And I don't think you're also supposed to be in therapy forever necessarily. Yes, sometimes people have been through terrible things, and therapy is a very helpful thing to have as a lifelong avenue to continue healing. But therapy is supposed to also help you. I like to tell people, I want to teach people how to be their own psychologist. I want you to be able to develop skills and self-awareness and all this stuff to then to be able to be self-reliant. That when bad things happen, you don't need me. I can be there for support, but you also have the strength and resilience to be able to withstand it yourself. And whether it's with therapy or whether there's other avenues too, like, I don't think it's the only way. I think it's a very helpful way. And obviously I'm a big proponent of it.
Yeah. I mean, the world has changed. I mean, to your point about individualism, it's like, we're in New York City right now. And, a lot of people come here with dreams, they come here with aspirations or whatever. And they don't have a tribe. They don't have people that they feel like they can trust. Which is very different from living in like little communities of, and I think that what therapy at least has done for me is like it's a space for radical vulnerability without judgment. And so like, I think the human paradox, if you will, is that we want to be fully known and fully loved. But that's actually like our deepest fear. And like we don't want to risk being like, oh, I just shared this really terrible part of myself. And then I either get ripped for it or someone's like looking at me weird or like shaming me. And so I feel like therapy really does in today's modern involved world, like give you a space to like work through that.
Yeah, it does. And I think there's also a very big cultural aspect to it too, right? Like there's certain, like my husband comes from a Persian Armenian culture where a lot of like arbitration and family, it's actually done within the family. And for them, it's sort of like, this is what works because this is my cousin. Of course I trust him implicitly, right? And so I think there are also a lot of cultures in the world where they're able to do that. It's just different, And so I think, again, in a westernized culture of the classic view of therapy, as you said, for us who might not be in tribes, it's a very important place. And especially, as you said, also sometimes tribes are very involved and it's really unhelpful and they're unhealthy. And so having that space that's just yours, which again, I think things like rabbis and priests and stuff like that are also play into that role. But one thing too, I think also in this model that we're in, I think therapy is also, it can be very self-indulgent. Like a lot of people are like, yeah, my therapist because I want to work on me. And not everybody, but, I think we've also, sometimes I think when we try to find balance in life and in society, we kind of swing to extremes.
The opposite direction,
right? And so as we try to find the middle ground, we'll kind of be swinging. And so, there are definitely a lot of people who, most people engage with therapy for absolutely beautiful and awesome reasons. And, I think sometimes it can be a little self-indulgent. And so, which is fine. I think it all shows that there's something a need that you need met. And that's actually a really good place to explore it in therapy. So,
yeah, I mean, you kind of see when you, like we do a lot of kind of like social listening and you see kind of that swing in the way that like more influential people or commentators are talking about things. And so I don't know, like the Andrew Tates of the world, or like I don't know, Candace Owens, and like I don't want to speak for like what their full opinion on therapy is, but it's almost like I feel like a part of our society thinks that therapy is just this whiny little thing about your emotions, like me.
Yeah.
And so I think it becomes hard for people to like wade through the truth of like actually go approach this thing if it's just feels so polarizing on the subject. So
Yeah. So it's messy, you know, there's like, you know, that's why I'm often always talking about kind of the middle ground, like where, you know, there's truths in different areas, and, you know, there's still a lot of taboo. There's still a lot of, you know, sections of society that do look down on therapy and think it's very self-indulgent and all that kind of stuff. And so, you know, I think that's why, again, coming back to how do you come back to yourself in terms of how do I know what's best for me?
Yeah.
And how do I engage with something that, regardless of what other people say or think, what's going to be the best for me to actually be able to heal, have accountability, to be able to transform, to be able to change.
Yeah.
And that, if that is therapy, that is awesome. And, you know, again, part of living a healthy life is being able to, take in information from wise counsel, but also not allow other people to dictate how you're going to live your life. Right.
Yeah.
So,
Yeah, I think that's good. I think the other dynamic is like, okay, some people want to go to therapy. And one thing I just don't feel like is talked about is there's kind of like these three levels of issues. And this mainly has to do with the government and like insurance, but A is like the accessibility of therapy. B is the affordability of therapy, and then the quality of therapy. And so in our society, obviously, psychotherapy, like I mentioned, is like 200 years old. So naturally, that means that there's a disconnect between the amount of people that actually need therapy versus the amount of therapists that are out there. And so some of the stats, even like when it comes to, you know, counselors in like K through 12 schools, it's like, you know, I don't know, it's like one person to 1,000 or 2,000 therapists. So that could be overwhelming of like there isn't enough therapists to meet the demand. And then the second thing is kind of like the affordability of therapy.
absolutely.
And since like in America, healthcare in general, when it comes to physical issues, is just so reactive. And it's like, oh, okay, we'll treat you once you have cancer. But, you know, let's just not care about the before that. And so I'd imagine with like, as a psychologist, like having to deal with like, you know, government isn't like, I guess, covering all the costs.
No.
And so, I mean, out of pocket costs for people could be so overwhelming. It could be like, you know, $65 an hour, which some people would think is a lot depending on how much income you're making, to, I don't know, the specialist for OCD, like could go all the way up to $450 an hour, which is like the rate of like a lawyer. And so, and if you do the math, it's kind of like, there's 672 hours in a month, and like if you sleep 8 hours a day, that would be an additional 224 hours. So that leaves us with like 448 waking hours like a month. And so let's just say you saw a therapist 1 hour every week. That's like 0.008 of like the waking time. And so it's like, it feels like, is it actually worth the investment? And then obviously like the quality of the therapy too. And it made it sound like I'm being a devil's advocate for not doing therapy, but this is like the reality.
It is. It's the absolute reality. And so, you know, and it's a crap situation.
Yeah.
And so, you know, I think what's really good is that there've been a lot of people who are trying to disrupt the system, right? People love disruptors these days, but you know, who are trying to solve that problem, to allow people to have easier access to therapy. You know, but it's, we're still ironing out the kinks in terms of quality control. You know, this, all you mentioned is tough problems. And I don't really know what the solution is, but, and so often the people who need therapy the most are the ones who don't have access to it. And that's a huge problem. And it's hard because for therapists, there's not a lot of incentives, you know, it's kind of like, especially and this is also like teachers, right? If you're working with the hardest of the population, it's a very thankless and emotionally heavy lift, and you're not getting paid to do it. No, who wants to do, it has to really be an altruistic call, which is beautiful, and a lot of people have it, but a lot of people are like, I'm going to burn out, I can't do this.
Yeah, you need to be financially stable to like start stepping into like the altruistic lens as a therapist.
Yeah, and so, and I think that's how a lot of therapists are managing it, in terms of like, okay, like I also need to live, especially if, New York City is the most expensive city in the world, right?
Yeah.
And so it's like, okay, I need to make a living. And so, I'm going to have people who are full pay, but then I'm going to have a section of people who, maybe I have sliding scale or low fee or volunteer in a certain way. And so, but it's very individualistic, it's very much up to the person to decide, how they do that. And so it would be great if there was like a governmental incentive where you were actually able to have a good salary, and you're able to really serve an underserved population.
Yeah. It's crazy because even when you look at like, I don't know, observe what's happening with the presidential elections, it's like, I feel like I never hear this talked about. Like, it's just like, so like not one of the main issues that's like talked about, but it's it feels like it's plaguing everyone, because the reality is like, okay, I'm going to go see a $65 an hour therapist. They could be good, but the reality is you're getting what you pay for. So like the care might not be that great. Yeah. But then do you feel like on the upper end, do you feel like there's an ethical dilemma for like if you're charging, I don't know, crazy amounts of money an hour, like do you feel like in that case is like, is therapists actually like really want to help someone in that instance? Like, what do you feel like is going on there?
Again, I think it's individualized. Like, I don't know if I can speak it as like a blanket statement. People are also doing therapy for different reasons. Yeah. People become therapists for different reasons. They want to invest in certain populations for different reasons. Yeah. And so, ultimately, yes, you are doing a service for people, but it's a business. It is a business, right? Yeah. And so, again, I would hope, and I think that a lot of people do that they are able to, okay, there's certain people who can pay that and it's not a big burden, and there's certain people who can't. And so how do I, leave opportunity for them? But, I think, I don't know. I think it's a good question. I haven't really thought deeply about what you talk about in terms of the ethical dilemma. And so yeah, but there's certain people that I know, as you said, who are specialists, and for one session, they're beyond that. They're in the 600 an hour, and I'm like, wow, that's amazing.
Like, I have to make like $40,000 more a year, or whatever, just to cover seeing them for 4 hours a month. Type of thing. Yeah.
But it's that person's, they can determine the rate, and so, it's really hard, because also, as you said, it's individuals helping individuals. And so each person is, making decisions for themselves, and they're making decisions for many different reasons. We don't know what those decisions are. And so I think it would be really helpful to be able to have something that's not on an individual scale, and actually more of a group, of like a, that's why we have organizations. That's why we have like hospitals, clinics, things that kind of take the burden off of the individual on both ends, to be able to make it,
That's
healthier,
good.
I think. But.
Yeah, I think, and this is just my opinion, but I think universally that like one of the things that therapy is strongest for, and you said this earlier, which is like, it doesn't have to be forever. And I think like when it comes to like understanding how our brains work. I mentioned like our conversation with Dr. Anna Lempe before, and she was talking about like the presence of high dopamine stimuli everywhere, and how that's influencing the mental health crisis and our ability to deal with emotions. But then the other part of the equation is like this, you can't avoid it, it's like this, the presence of mental disorders, trauma, other issues like that. And so I think you need a specialist, you need a therapist to be able to like help you work through like this is how your brain works, and I specialize in this issue, and it kind of helps you like develop a game plan for how to move forward.
Yeah. And I've had some patients, especially ones who are kind of older, and they're like, why has no one told me this stuff before?
Yeah.
Right. And it's because it really is, it's like an area of knowledge and skill that you don't necessarily have access to in your day-to-day life. And so, that's why I tell people, I'm like, listen, like I've been to tons of school for this, so let me help you and I'll teach you what I know so that then you can kind of implement it in your own life.
Yeah. Yeah. I mean, it's a scary thing to go so many years of your life and not know how your brain works. So like I was diagnosed with OCD when I was like 26. And so, I'm 34 now. But I have earliest memories of probably things that were symptoms of OCD when I was like 8. And so you have like an 18-year gap in my own life. Yeah. And I just feel like my relationship with myself has like completely changed since I like learned that like, oh, that's what's going on. Because it's like kind of this just hidden thing of like, why do I feel like I'm interacting with the world differently than other things? And so which ones do you treat the most, and like what do you see most in your practice of like different mental disorders?
Well, I specialize in treating anxiety disorders. So I see a lot of OCD in my practice. I see a lot of generalized anxiety, which is like a pervasive and chronic worry. I see a lot of panic disorder. I see phobias. So things that fall under the anxiety disorders umbrella. And so anxiety disorders basically means different ways that anxiety will manifest depending on the individual. And so, but the main driver is anxiety, and it'll manifest in different symptoms, right? Whether it's OCD, whether it's panic disorder. And so I see a lot of that in my practice. And when we talk about disorders, right, mental health diagnoses, if you think about what they are, there are a bunch of people, getting into a room and saying, this is what it means to have anxiety.
It's a cluster of symptoms.
Yeah, exactly, right. But people are determining that, and we're constantly evolving in that, right? And so I like to think of it as a continuum, that we're all on continuums of these different things. And sometimes people will bump up into a clinical range, which means you have the diagnosis. And sometimes people are in a subclinical range, meaning they'll have several of the symptoms, but not enough for like a diagnosis. Yeah. And so I see a lot of people also in that range where they might be like type A, high achieving, high functioning, but they have intense anxiety, they have intense problems with relationships, they have depression, so I see a lot of sort of dysthymic depression as well. And then, just general stress, relationship issues, so there's also kind of like the general bucket. And then people who've had, I've worked with trauma veterans for quite a while. And so my practice, there's some people who also have those trauma histories, but I think it's mostly just because of what I specialize in. It's anxiety.
Yeah. There's multiple different theories on this, but so if you look at the kind of addiction, high dopamine stimuli thing, and you look at a chart, you'll see just with the age of social media, it just goes like way up. Yeah. But then when it comes to things like OCD, bipolar, schizophrenia, are you of the mind that these things always existed, or that they are a result of something that's happening in our present moment, or circumstances that have changed over the past 100, 200 years? Because it feels like there's been an explosion as well in just the presence of these disorders.
Yeah. I think a couple of things. I think that, yes, probably these things were around, but now we have a lot more information. We have a lot more access to information. We're a lot more open about talking about it, right? And, we've had huge advances in terms of being able to label some of these things as, whereas before it might have been more of like a general, they might have called people possessed, right? They might have called people hysterical. There were different names for these things earlier on. Yeah. So I think that there is a lot more understanding. I think there's a lot more accessibility and all of that good stuff. And then, I think we also, we deal with different things. So I don't know. It's unfortunate that we don't have necessarily a lot of data to be able to examine that. But, I think, what's interesting is that depending on where you are in the world, people also have different symptomatology. Yeah. And so there is also a cultural influence,
Yeah.
right? So different cultures, maybe they have more physical symptoms that manifest that actually relate to mental health. They call things a different way. They describe things differently. So there is absolutely a cultural element to it as well.
Yeah, that's really good. And you have somewhat of background with like neuroscience. So can you tell me about like specifically with like OCD, like what's actually, because you could see it on a brain scan, like what's actually happening with OCD?
Yeah, so if you look at an OCD brain, what's basically happening is that there's certain pathways in your brain that kind of go between the emotional center and your frontal lobe, where you make all these like, decision making, evaluating. There are a lot of different pathways that are overactive and certain pathways that are underactive as opposed to a non-OCD brain, right? So it means that your brain is actually a little bit out of balance in terms of how it's firing. And so as a result, we have certain checks and balances in our brain that help us survive, right? So if I'm walking down a dark alley and I see a shadow move, I have an electrical impulse in my brain that then sparks an alarm bell saying, danger, danger, there's something wrong. You have to do something about this.
Yeah.
So I have to run away, right? Or I have to protect myself. So with someone with OCD, that misfires a little bit.
Yeah.
And so as a result, you get these alarm bell signals about things that aren't necessarily factually dangerous, right? So a classic thing is sort of cleanliness, right? And so people who are, really anxious when it comes to germs, they have that kind of similar reaction to a life or death situation, but it's happening with needing to wash their hands, or
It's like it's actually happening.
yeah, exactly. And so that's why OCD is one of the most debilitating diagnoses out there, because it's also, along with that, your brain, I like to call it a sticky brain. So not only is that happening, but with OCD, you also see a lot of intrusive thoughts, right? And so we all have intrusive thoughts. It's a normal part of being alive.
Yeah.
Like you'll be, if you see something on the news about someone killing someone and you have like a thought, you're like, I wonder what that'd be like to like shoot someone, or, it happens all the time.
Yeah.
But with someone with OCD, they have a sticky brain, meaning that those kinds of thoughts stick around and they're hard to get rid of. And so as a result, because you have this intense emotional reaction as well as this intrusive thought, it makes you think, oh my gosh, this thought must be meaningful and it has to be dangerous. It must mean something really awful, right?
Yeah.
And so as a result of these obsessions, which are intrusive, unwanted thoughts, images, or impulses, that create a huge emotional response that is a very real, and it feels extremely real because it is.
Yeah.
You have it biologically going on. Then you do compulsions, which are ritualistic actions, or even in your brain.
Yeah.
So behaviors to try to mitigate all of that, right?
Yeah.
Because you're like, something's really wrong. I have to do something to fix it, right?
Yeah.
So you might start avoiding certain things. You might start, cleaning things more. You might, it might be saying prayers, counting numbers. There's many different varieties of it. And so that's why a lot of people with OCD, they believe they're having a psychotic break because they're like, I don't, this feels so real, but there's also a part of my brain that knows that this isn't quite what's happening.
Mm-hmm.
And so it's really distressing. And that's why, and a lot of people who have OCD are higher intelligence and they're able to maneuver around a lot of this stuff. And so it usually takes around 7 years on average for someone to get a diagnosis.
Yeah.
And then from there, because the treatment is, I believe, one of the hardest treatments in the mental health world, it takes another 7 years for someone to actually want to engage in treatment.
Oh my gosh. Yeah. Yeah, I mean, the OCD thing is, it's on one end, it's kind of insidious because it's so easy for people to think that, like, it's 3 to 4% of the population or something like that has been diagnosed with OCD, but I actually feel like it might be way higher than that.
Yeah, sure.
Of just people that are undiagnosed.
Because a lot of people don't, as we said, there's a huge lag in diagnosis because it's also, people don't want to talk about it.
Yeah.
And they don't know what's happening.
And then there's these taboos I don't know, it's just like these stereotypes of like, in the culture of the hand washing and like all these kind of like crazy organizational things, but like three like maybe practical examples of OCD is like especially when it comes to your health. It's like a normal person might like have a headache and it's like, oh, is that brain cancer or something?
Yeah,
But then the OCD person will be like, oh, well, it's brain cancer. Wait, no, it's brain cancer. Like, and then you just start kind of going crazy about it, or maybe relationships even.
Oh, yeah.
A lot of
There's
people
a lot of relationship
with
OCD.
relationships are like, when they have OCD, it's like, is this person the one for me? Are they not the one? Are they the one? Like, oh no, I don't like that about them, but do I like that? And so it's like this deliberation. And so one of like the biggest things with OCD that I see people like rationalize it with, which could be difficult, is like, well, anybody would kind of do that with the relationship. Like, and so it's really hard to wade through all that stuff.
Yeah, absolutely. Because you kind of, and this is also what we're talking about in terms of self-awareness, right?
Yeah.
You're not entirely sure because you're living in your brain. To you, it's normal. It's just the way you live your life, right?
Yeah.
And so being able to have someone be like, actually, you don't have to live life like that is really freeing to be like, oh, actually, maybe, and I often, what you describe, OCD is also known as the doubting disease, right?
Yeah.
It kind of, OCD takes the 0.0001% chance that something might happen. And it's always like, but there's a chance, but there's a chance, but there's a chance, right?
Yeah.
So that a brain who doesn't have OCD will say, oh, it's probably not brain cancer. But
yeah, they live with as if there was certainty, even though there's not
exactly.
really, but yeah.
There's no certainty in the world, but when you have a brain that has, when I talked about these overactive or underactive pathways, you're able to feel a sense of certainty and move on because your brain is a machine. It calculates risk all the time. And so even getting into a car, there's a lot of risk getting into a car. You could get into an accident, but your brain is able to calculate this risk is worth it because I need to operate in the world, right? Whereas when you have OCD, that barometer is malfunctioning.
Yeah.
So it feels like it's 50-50,
Yeah.
right? And so it's that constant feeling of doubt, and it's really emotional, right?
Yeah.
People, they think it's sort of more of a brain thing or a physical thing. It's actually an emotional thing.
Yeah.
And so it's, and as I said, a lot of people operate around it. They're able to manage it, and so they don't really have to. Often, I see people in my office is because they're finally like, the OCD's gotten bad enough that it's really impacting their life in a negative way. And they're like, I actually do really, I can't manage this anymore.
Yeah, I mean, the important thing to say on the OCD subject is that, like, you could literally obsess about anything. And the weird thing about it is, like, sometimes it almost feels like a superpower in the sense of, like, so it's like this, like, it feels like just horrible sometimes. But then the flip side of OCD is because people are able to see things that other people would never be able to see, and look at things and do things with such detail, and that's where you saw like the intelligence thing is like is pretty high. So
so a lot of people who have OCD or OCD like, so there's things like body dysmorphic disorder, things that are kind of in that bucket, they're often in very detail-oriented jobs, graphic design. You see that, sometimes that there's patterns in that because, as you said, there's certain details and certain things that they're very good at, but then it starts to become maladaptive in other areas of their life.
The other big thing in our culture is trauma, and so you treat some trauma-related disorders, and again, I think advocating for therapy in this sense. Obviously, the body keeps the score was I don't know, this just like took off in our culture. Like that book is just kind of like a phenomenon of like, I think it's still on like it's been out like 8 years, but it's still on the New York Times like bestseller list. What's your opinion on that book? Did you read it?
A while ago now.
Yeah.
So, and it's a big book. So, but I think it's awesome because, people have certain opinions on different things that they think that there's problems with. But just I think in terms of educating people on the connection of the brain and the body. And that's, I think, something that now we're moving into an era where we're really paying attention to the body, which is extremely important. Before, with a lot of old school psychology, it's all about the brain, but your body works as a unit. It's a system, right? And so kind of being able to see things holistically and systemically, and how your body and your nervous system impacts your brain and vice versa. It opens up whole new avenues to healing. And I think it resonated with so many people because it's so many people's experience, just in terms of how you can also do things in terms of your body and how emotions live in your body.
Yeah.
How, and if you look at old texts, even things like the Bible and or like the Old Testament and the Jewish tradition, they talk about the mind, but if you literally translate it, it's called the heart.
Yeah.
Because they believe that a lot of wisdom, a lot of emotion, a lot of stuff came from there.
Yeah.
So talking about things like nervous systems and I think it's really helpful, and it's just opened up a whole other avenue.
Yeah.
That's very important.
Yeah, I mean, touching on the neuroscience subject, like, in reading that book and just looking at like the brain scans of people that have had trauma, like, I don't know, reading that book, I was just like, there's so many evil things that have happened to people, and it's just like unspeakable evil. The fact that like their brain literally just shuts down because they can't like deal with it. Like, I don't know, being like raped by your father when you're like 5 years old or stuff like that. It's just like, and so I think that there's spectrums, and there's a spectrum of trauma, but I think understanding how your past is influencing your future, generational familial patterns, familiar wounds, all of that stuff has kind of made you into the person that you are today.
Yeah.
And a lot of people are kind of like, oh, well, just leave the past in the past. Let's not deal with it. But like, what would you say the danger is if you were to actually adopt that mentality and be like, oh, just leave the past as the past?
Well, as you said, I think, one of the brilliant things that it's also done is that I think it's taken the burden of responsibility off of maybe victims and actually been like, this stuff has physically, biologically impacted you. So the way that you're behaving, there's a reason for it, right? It's not just because you're quote unquote crazy or you're quote unquote like, disturbed. Yeah. It's, you actually dealt with stuff that has completely changed and transformed your brain, your body, your biology. And so it's not necessarily excusing bad behavior, but it's explaining why people do what they do, right?
Yeah,
and that's what I often talk about is try to, how do we actually approach things with curiosity and be like, there's a reason why you're behaving this way, or, and so let's try to go to the root of what that looks like. And then again, the good news is that there are ways to transform that and to actually heal these things. Yeah. With people who have that mentality of kind of like, oh, move on, it's in the past. It's, it's just so invalidating, so dismissive, and it's so wrong because, yes, there are some people who maintain things by being attached or obsessive about certain things in the past, and actually the proper work is to be able to learn how to accept and let go. Yeah. But for most people, it's, rather than leaving things in the past, it's like, how do you actually transform it in the present so that it can look how you want it to look in the future, right? Yeah. I mean, getting into kind of how this kind of affects your dating relationships and whatnot, like one of the things with the past that zero human beings can get away from is like what's been revealed through attachment theory about and so like a lot of people don't understand that the care that they got as a kid from their usually a parent, father, mother, but it could have been just like your chief, that type of care now is being assimilated or projected now into your adult relationships, and you don't even know that that's happening. And so can you tell us a little bit about what attachment theory is? Yeah, attachment theory was coined by John Bowlby and another one of his colleagues. I can't remember what her name is right now. But and it was basically a framework in order to be able to explain why certain people behave the way they behave in relationships, right? And the idea is that the relationships with your caregivers directly impacts the way that you relate to other people as an adult. Mm-hmm. And so he put things into 4 categories: secure attachment, anxious attachment, avoidant attachment, and disorganized attachment. Yeah. Right. And so secure attachment is, if you had healthy families, healthy parents or caregivers who met your needs, gave you love and reassurance, all of that manifests in you being able to have healthy relationships where you're okay by yourself, and you're also doing good in relationships. It's not like you need someone to fulfill you or to complete you. You're able to manage your emotions well. You're good at communication. You're able to think optimistically about your relationship and have basic trust, and believe that your relationship is going to succeed. And so that's kind of the secure piece. Anxious attachment that a lot of people relate to, is when you need a lot of reassurance in your relationship. You're basically very afraid of rupture. You're very afraid of abandonment, and you're afraid of being alone.
Yeah.
And so as a result, you need a lot of reassurance. You can be a little bit clingy. You can be codependent. That can often happen.
Yeah.
And you're constantly attuned to disconnection in your relationship. So if your partner is having a bad day and doesn't respond well, your alarm bells are going off as like, oh, I did something wrong, right? And, John Bowlby thought that was as a result of having caregivers who were kind of disorganized or unpredictable in how they related to you. So sometimes they were really present, but sometimes they weren't, because maybe they had their own mental health issues.
Yeah.
Maybe they made you responsible for their own emotional well-being. And that's why a lot of people, feel like they're responsible for their relationship, for this other, for your partner, right? Avoidant attachment is when emotional intimacy makes you very uncomfortable. You feel very independent. Having someone too close feels really smothering, and it feels really, you feel really trapped. You have relationships, but they kind of only go so far. You don't let someone in, so people kind of feel like they don't quite know the depths of you. And so that's from caregivers who were just sort of emotionally checked out, kind of didn't fulfill your needs, or were very delayed in fulfilling what you needed, or were very dismissive of your emotions. And it doesn't necessarily have to be abusive. It's just like, if you had two working parents who were emotionally checked out and you basically had to take care of yourself, right? You you're teaching your kid, you can't trust people. People are not going to fulfill your needs. And so you have to fulfill your own needs, right? And so then disorganized is kind of a mix between anxious and avoidant. Basically, you're desperate for love and intimacy, but you're also deathly afraid of it, so you push people away. It tends to be much more disorganized, meaning like a lot of people who have trauma backgrounds, who have severe mental health issues, they kind of oscillate between the two. And so when we talk about attachment theory, some people think it's a bit reductive. That's not only what people deal with, but it can be a helpful framework to also help you think about how your relationship with your caregivers affects you now. And one thing that they talk about is how it's not like any of these is wrong, quote unquote. It's not like there's something wrong with you for relating in this way. It's information.
It's what happened to you.
It's what happened to you, right? And so this is now information. And so rather than feeling, quote unquote crazy or incapable or defective, you can actually work towards how do I, especially because you do it with, with your partner, if you're aware of how you guys operate in that way, you're able to then communicate effectively and have ways to create a healthier relationship.
Yeah, I think, attachment theory in general, it's like, it speaks to this idea of this innate desire that we all come out of the womb, that we need love, we need care, and none of us can get away from that. And I think I've studied attachment theory over the past few years, and it's like, even with the avoidant attachment, it's not like you don't want it. Like on a biological level, it's not like you don't want it. It's just like terrifying to you.
Absolutely.
And so the thing with attachment theory is like it's not a physical philosophical idea, or it's not even like this science that's very hard to understand. It's like a very lived experiential thing. Absolutely, like people who are on dating apps right now could immediately identify, oh, okay, I'm dealing with, like, if you understand the concept, it's I'm dealing with like an avoidant person right now, or I'm dealing with an anxious or clingy person right now. And so I think the topic and just the awareness of it is like needs to be talked about like so much more.
Yeah, absolutely. It's really helpful.
Yeah. And so, and then also what's interesting is like when attachment theory intersects with neuroscience. So Regina Sullivan, she was a neuroscientist is a neuroscientist at NYU. She wrote in a 2012 report that even with proper nutrition and perfunctory care, if an infant does not receive affectionate social interaction, her physical development will be stunted and her brain development compromised. And so, you had mentioned earlier that we actually have no control over what's happening. Like our brain development actually might, per studies, that be stunted in some ways, especially like relationships socially, because that this has happened. And then we talk about the mind, body, and spirit a lot. And so when Jesus walked the earth like 2,000 years ago, he had a theory or a sense of what love is, which is like a self-sacrificial type love. Yeah. And so Tim Keller, who's an author, he wrote your new child is the neediest human being you have ever met. She needs your care every second of the day, 24 hours a day, 7 days a week. You make enormous sacrifices in your life, and yet the child for a very long time gives you nothing in return. And while later the child can give you love and respect, never does she give you anything like what you have given her. And so I think what's interesting about attachment theory, about what Jesus claimed about love, is if we as parents don't embody self-sacrificial love, it actually literally negatively impacts your brain development. And then you're kind of spreading a world of anxious and avoidant attachers into society, which is cripples kind of our relationship dynamics. So
that's why I'm such a proponent of people getting healthy. And listen, we're never fully arrived. You're never perfect. You're always going to make mistakes. That's okay. You don't have to be perfect, but it's true. How do you not? This is why a lot of these days people are talking about cycle breaking, which, is basically talking about how do I not perpetuate stuff so that I can raise functional, vaguely healthy kids who can have good relationships. So I think it's the nature, we were talking at the beginning just in terms of negative thoughts, and, I love how you brought some of the stuff in there about, we live in a fallen world. We live in a world where a lot of bad things happen. And so it's unavoidable, but it's how do I navigate it in a way that I can do the best I can within that space, right?
Yeah, perfection is not possible, and I think that's completely unrealistic of a goal, but it does set a precedent of the type of love that we both need to give and receive. And I think the kind of transitioning a little bit into dating is I think we could feel a lot of shame about the way that we are. And I thought you had this it was a really powerful analogy that you had on social media recently about drinking a glass of water. And so I think a lot of people have shame that oh my God, I'm so needy in relationships. But it's really just something that had to happen to them. So can you explain to us what the
analogy
was? The analogy with drinking water?
I was actually told anyway, I thought it was so powerful too, which is why I wanted to share it with people, is because people often they feel so much shame, as you said, about feeling really needy or feeling really anxious, and so it was talking about how if someone has been walking through the desert for 3 days without any water, if you were to give them a glass of water and they were to gulp it down hungrily and then ask for another one and ask for another one, you would have compassion and be like, I understand why this person is so needy of this water, because they have been starved of it, right? And so it's the same idea when this quote unquote idea of neediness. It's not coming from a place of, of malice or purposefulness. It's actually because there's a deep need and a starvation that we've had. And so rather than, again, bringing shame and judgment, how do you actually look on it with compassion and say, okay, let's figure out how to get this need met so it doesn't feel so desperate for you anymore.
Yeah, that's so good. Yeah, and it speaks to the idea of kind of helping fill in a gap for your partner, if that is what their background is and that's what they struggle with, and being aware of that is critical. So yeah, when it comes to dating and relationships, obviously doing the individual work on yourself is important. So what would you say the danger is of not being self-aware and not doing the work and then seeking a relationship, which is very common, you know?
It is. It's very common, you know? And so I talk so much about, you know, people are focused on this goal of getting a relationship and getting a boyfriend, getting a girlfriend, getting married. And you're not actually thinking holistically about your life. You can get married, half of marriages end in divorce, you know? And that is even more painful than being alone.
Yeah.
It absolutely is, you know? And so people are so focused on the here and now, they're not actually thinking about how do I build something, good foundations where I can have a successful relationship, not just a relationship, you know? And so that's why people have garbage relationships, because, and it's not the only reason why, but I think a big reason why is because, you know, it's in order to be able to have successful long-term relationships and also be able to have healthy choice, right? To like choose people who are good for you versus not good for you, right? It kind of impacts absolutely every single part of your single journey, your dating journey, your relationship and marriage journey. And so it's, you know, we are meant to be, I believe as human beings, we're meant to be in relationship, whether it's romantic or not. You know, building self-awareness and working on ourselves helps us have life-giving, beautiful relationships that then creates a beautiful life, you know?
Yeah. Yeah, I mean, one of the biggest forms of baggage that people bring into relationships is like just poor communication skills as well.
Yeah,
and so
sure.
Why do you think, especially like our generation, struggles with communicating so much?
Well, communication takes a lot of courage.
Yeah.
You know, well, it takes courage, and it takes self-awareness that we've been talking about, right? A lot of people don't have language to describe what's going on with them or how they're feeling, right? And so a lot of what I do and work on with people is actually how do you put language to your experience so you can communicate effectively to actually be able to show someone what's going on, right? And that takes courage because you have to examine yourself, and you also have to express maybe something that's very vulnerable and ugly to somebody, right? And so people you can blame, you can kind of not take responsibility, but that's not going to help your relationship. It's not going to help you, right? And so it's not easy, you know, because again, it takes courage, it takes building self-confidence, it takes building self-worth, and then it also takes understanding yourself enough where you can have the language to do it. So the good news is that it's a skill that you can learn, but a lot of us haven't necessarily learned it because we don't have parents who did a good job of teaching us about it. And then if we weren't in environments where that was cultivated, you know, we need to have someone teach us this stuff. It's, you know, again, some people have it intuitively, but most of us need coaching. And so, you know, even for relationships, and, you know, I'm such a big proponent of premarital counseling and couples counseling because people expect to get into a relationship and just kind of, I like you, and so it's supposed to work out. It's friggin' hard
without
work.
thinking it through.
Exactly. And it's like, you have to, you know, if you want to be successful at your job, you have to work at it. If you want to have a successful relationship, you have to work at it. It's not, you know, it's inevitable, unfortunately.
Yeah, that's really good. I mean, so in terms of the progression of like a relationship, okay, let's just say someone feels like they're ready to date, or whatever, has made sense of some of the things with self-awareness or attachment, whatever. You know, obviously the starting point for finding a partner today is completely changed. It's like dating apps.
Yeah.
And so that can make dating in the digital world kind of quite brutal because people are just kind of commodities. Like you're seeing like 95 different people like a day of like just swiping through profiles and stuff, and just trying to, it's almost like sifting through, like the more options you get, it's like I'm sifting through junk to like find like a meaningful connection. And so like, what's your opinion on and take on dating apps in general?
As with anything, there's positives and negatives, right? And I think that there's a way to engage with dating apps that can be healthy and effective and a great way to meet people, right?
Yeah.
It's opened up a whole way of meeting people you might never meet before. And a lot of people meet on apps. And so that's wonderful. But I think, I talk a lot about intentionality in living your life. Living intentionally, meaning thinking about how you're engaging with whatever's in front of you. So even when it comes to dating apps, thinking about how you're going to engage with this thing is really important rather than doing it reactively, right? And so as you mentioned, being able to bring awareness that there's human beings on the other side of this thing, that you do not know a whole entirety of a person based on a profile. Also that people who ghost, people who, are incessantly chatting on the apps, being able to have certain standards and rules for yourself where, okay, I'm going to tolerate certain behavior and not tolerate others, right? It's kind of like, and so there's an element of, if you're able to be as healthy as you can be in it, it helps you be successful at it. It doesn't mean it's easy, because it also can promote a lot of bad behavior.
For sure.
I don't want to say bad, but disrespectful behavior where you feel like, oh my gosh, I'm just like, I'm not a human being. I'm not treated as a human being.
It feels like that's become like there's all these like new terminology that's been introduced over the past 10 years of ghosting, breadcrumbing is like another one, like orbiting, like all this type of behavior.
Oh my gosh, I can't keep up. Yeah, it's like my patients teach me these things, and I'm like, what's that? Yeah.
And so you've said some things about ghosting in particular. You want to talk about one of the most recent posts that you did on that, in terms of like why we feel compelled to like reach out to someone, like when they've ghosted us. And
ghosting obviously is very prevalent these days because apps and kind of an online medium makes it very easy for someone to not have to have a hard conversation and just to kind of not respond to somebody. And so when somebody ghosts you, it hits on some fundamental needs. It hits on a need to be certain, of certainty and safety. It hits on a need of self-worth and value. And so because, you were talking about dopamine earlier, right? And so because someone who ghosts hits on these areas of insecurity, basically what you want to do is you want to do everything you possibly can to get that security back, meaning get certainty back and get worth and value back. And so the temptation to text someone or to reach out to someone or get an explanation from someone is to try to alleviate the discomfort that you're feeling. And so, recognizing that that's where a lot of those urges come from. A lot of people talk, they get ghosted and then they're obsessing about it, right? They're thinking about it. They wanted to reach out to this person. They want to wonder why, they're in that state because they're trying to alleviate that feeling of uncertainty and that feeling of low self-worth. And so rather than finding it in this person who obviously, it's not, most of us have ghosted. It's not a judgment call, but it's kind of like, okay, this person obviously wasn't for you. How do you actually get those needs met in other ways, right? And to recognize that your desire to reach out or to connect isn't because you actually like this person very much. You're literally coming from that urge to alleviate a negative feeling that you're feeling. And so if you're able to tolerate that, to not personalize it, to find self-worth and value and be reminded of that in somewhere else, to let go of this idea of certainty and actually, be able to come to a sense of certainty for yourself that you're never going to know, and that's okay. You're able to then not engage so much emotional energy in trying to re-engage someone or figure out why.
Why do you think it's counterproductive to like engage with that and then like to pursue, like if someone's ghosted you?
Well, because you're probably not going to get what you want, right? You're looking for something and you're looking for certainty. And even if someone explains to you why they ghosted, it rarely puts the situation to rest. Because you don't believe them or it's not enough, again, because it's not like this is something that's going to satisfy your need. You're always going to have that uncertainty. And so, and then having someone re-engage and you're like, oh, that means that I'm worthy and valuable. None of this stuff is actually works in giving you worth and value, giving you that certainty, right? And plus this person probably isn't for you if they've behaved this way.
Yeah.
A lot of people expend so much energy in trying to make something work, because of their feelings of insecurity. And it's like, it's one of the bravest acts of self-love to actually let go of somebody who you might really like and say, this person actually isn't for me, and I'm sad about that, but I'm not going to put myself through the ringer to try to win something back, because of trying to fulfill a need that another person can't fulfill.
Yeah. So how does one handle rejection?
Well, I did a post about that too, so you can go watch that. But, rejection sensitivity can really stump us in life. And rejection sucks. It's terrible. Everyone hates being rejected. Of course you do. But people who can actually change their relationship to rejection to have it not sting so much are going to be so much more successful in life. And you can see that actually in people who are successful. They have more resilience when it comes to rejection because we're all going to get rejected. And so if you're able to turn your perspective and change your perspective that rejection isn't about you, it's actually for you, right? It's merely information about the compatibility between you and whatever you were rejected from. And so, if you can look at it as this is actually for me because this wasn't good for me, you're able to bounce back a lot quicker and not personalize it so much because there's so much we don't know. We were talking about mind reading. We were talking about all these cognitive distortions. People always, project all of your own insecurities and stuff onto why someone might have rejected you.
Yeah.
But there's 1,000 reasons why, right? They might have gotten back together with their ex. They might have moved countries. They might have had a terrible accident. They might have, they might be dealing with, they might be really creepy, dangerous people that you actually don't want to be,
They might be avoidant. Yeah.
They might be avoidant, right? There's all these thousands of explanations that, that could also be true.
Yeah. Yeah, I think one of the phenomenons in our culture when it comes to rejection is to use that as this like fuel, like, and I really want to get like a psychological opinion on this. Is like to use it as fuel of like you hear the term like revenge bot or like something like that, where it's just like kind of like, okay, you rejected me, and now I'm gonna spend my entire life making you regret that decision.
Yeah.
And so I wouldn't necessarily, I mean, it could apply to somebody who's ghosting or you're just talking to for a little while. I think it could especially apply after a breakup or something like that. But like, I'm going to make myself so good and like so important that you're just going to regret this for the rest of your life. And so like, do you feel like that, what do you think of that attitude and just like handling rejection that way?
Listen, I think it's a very human reaction. And I think that after, like, for example, a big breakup or something like that, it's okay. It's okay to feel like that. It's okay to be like, I'm going to show you, because you're processing something that's really hard. And, if it's helping you create healthy behaviors, okay, great. If that's happening a year later, 5 years later, if it's actually then the motivation for a lot of what you're doing for a long period of time, that's not necessarily healthy, right? You're actually giving all your power away to somebody else, saying, I'm doing this because of you. Even if it's healthy behaviors, you're still giving away all your agency and power to somebody else and what they did to you, right? It's very powerless. And so, so I think with a lot of things, I tell a lot of people, I'm like, it's normal. I don't blame you for hating their guts and being angry and wanting to do all these things. That's okay. I think sometimes the length of time, if this starts to become, more in your life or, and usually people do that and then they kind of get over it and they kind of, but,
Yeah. I mean, it's just like this motivation, like kind of like takes over, and it's kind of like you start, I don't know, you're like, oh, I just lost 30 pounds now and did all this stuff because
which can be really healthy. And so as I said, if it helps you, if it helps you create healthy behaviors, and again, very human, but then we want you to maintain that healthy behavior because it's actually good for you and you want to do it for yourself because you love yourself, as opposed to because someone else is a jerk, you know?
You also had a post about like, how do you keep yourself from spiraling after a breakup?
Yeah. Yeah. You know, this all speaks to resilience and kind of managing your mind and managing yourself in the midst of really hard emotions, right?
Yeah.
And so there is going to be an element of spiraling because it sucks. It's so painful. You're dealing with a painful thing. And so you're going to be ruminating. You're going to be thinking about it a lot. And so again, that's very normal. That's okay. But we also want it to be in a healthy range, right? Not where it's you're indulging it so much that it's really impacting things in a very negative way. And so, you know, I like to give people perspective and how to think about it in a different way, because when you're in an emotional state, that's all you see, right?
Yeah.
And so if you actually think about it, I talk about it being like a love drug, right? That after you go cold turkey when you're with somebody, you get a lot of dopamine hits.
Yeah.
You get dopamine hits when you talk to them, when you spend time with them, when you hug them, when you see pictures of them, even social media posts.
Yeah.
All of them are dopamine hits to your brain.
Yeah, it's like, oh my God, the
Exactly.
person. Yeah.
Exactly. So, and we love that. We love dopamine. When you break up with somebody, or when that person is out of your life, you suddenly have a dopamine deficit. You have a big trough of where you're not getting those dopamine hits
It's like a
anymore.
withdrawal.
Exactly. So you're in love withdrawal and you're jonesing for some hits, right? You're like an addict. And so whether it's checking on social media, it's looking for texts, all of those are dopamine hits to your brain.
Yeah.
And so the key when you're going through withdrawal of a substance is to go cold turkey and to wait and give yourself time for the dopamine to rebalance in your brain so that those hits don't actually become as appealing anymore, because you have dopamine back in your brain at a normal level. And so even when you're thinking about that person and ruminating about that person, you're still receiving dopamine hits. And so if you can look at it from that model and be like, okay, I'm going to be in withdrawal for a while. It's going to be really hard. I'm going to be jonesing for all the hits.
Yeah.
But how do I structure my life in a way where I can throw myself into exercising and seeing my friends and doing fun things and not, maybe it's about muting them on social media so you're not looking at
So
their
it's like
posts for a while.
replacing that activity with something else. Yeah.
Exactly. And also knowing that it's going to be hard, knowing that you're going to be an addict for a while. And so having mechanisms in place to help you manage that. And again, you're not going to be perfect. You're going to think about your ex. It's going to happen. But there's also ways of not indulging it to the point where it's maintaining itself for a long time.
Yeah. Yeah, that's so interesting when you're talking about just love as kind of a drug, because we had talked about that in an episode with Dr. Lemke about just how it functions with a drug, and then like how the whole withdrawal process, which I think you did talk about in your post, is just, it is literally like you were using cocaine,
Yeah,
and
it's
now
biological.
you're
That's
not
why it's
using
so
cocaine.
powerful.
Yeah.
Yeah.
One thing on just dating that I had questions about, that you are adamant about focusing on the process and not the outcome when dating.
Yes.
And so one question I had is, like, there's an ancient proverb that says, like, where there's no vision, the people perish. And I feel like some people, especially people that might be avoidant attachment or just really have a strong fear of commitment, might never think about, like getting married to this person or like whatever. And so, like, is there a tension there? Like, and what do you mean when you say, like, focus on the process, not the outcome when dating?
When it comes to any of this stuff, it doesn't universally apply.
Yeah.
Right? People are very different. There's different experiences. And this is also, the danger of online social media stuff is that you can't speak to every person's experience.
Yeah.
You are speaking to maybe a subset of people, specific people. It's sound bites. It doesn't incorporate the whole gamut of the human experience and complexity, right? We're reducing things to really simple terms. So, so I think that, as you said, it's a balance. I think because I deal with a lot of anxious people in my practice, I think more often than not, I see a lot of anxiety around dating, where people are so focused on, I have to get a relationship, I have to get this person to like me, I want to get a relationship, I want to get married, that they are not present to the actual process of dating, which is actually how you're going to be successful.
Yeah.
Right? And so I think that you're right. You need to have a vision of what you want.
Yeah.
Otherwise, you're going to accept whatever comes your way, which is also not healthy, right? So I think being able to listen, if you also have like an avoidant person or someone who doesn't ever want to get married, that's a vision for your life, and that's okay, you know? And so it's important to be able to date accordingly, right? To not lead people on and to be like, hey, this is actually the vision for my life. Are you okay with this vision or are you not?
Yeah, it's
right?
expectations.
Yeah, exactly. So,
and you might not be aligned.
And you might not be aligned, which means that you're not compatible, and that's okay.
Yeah.
Right? And so, you know, I think it's really important to be able, I think it's great that you mentioned that, because I think even people who are so focused on the outcome, they're focused on the wrong outcome. They're focused on getting somebody. They're not actually focused on what is going to be the right person for me that is going to help me have a healthy long-term relationship. You know, people might do that, but then they're so desperate to have something because they're afraid of being alone that they'll compromise a lot of their vision. Yeah. You know, and so I think that there's an element of having vision, but then holding yourself accountable to that vision. Yeah. And so, you know, I think that the vision is a really healthy thing to have, but what people are often focusing on isn't that vision, it's on a really anemic version of that vision.
Yeah, I mean, you mentioned the word compromise. I mean, there is a component of fear of being alone, but why do you feel like that's the main component of why people are so quick to compromise?
Again, it's not universally applicable. I think for a lot of people, it might be a fear of being alone. It might be also finding your self-worth and your confidence in external places, meaning how people view you. If someone wants to be with you, it makes you feel good about yourself. Yeah. And so people will compromise it because the person that they're engaged with right now, even if they might not be, you know, the right person, that feeling of rejection or not being enough if this person rejects me is too large to bear. So I will settle to be chosen by this person because it makes me feel good about myself, right? Yeah. It can also it can come from kind of those unhealthy places of, unhealthy places that can look very different depending on the human being. So yeah, I think it depends.
Yeah. So, I mean, you don't have to share this, but like, so you recently got married,
yes,
correctly?
I did.
Okay. So
a year and a half ago, almost. No, almost 2 years, but between a year and a half, 2 years.
And so that happened in your 30s, right?
Yeah, my late 30s. I got married when I was 37.
Yeah. Yeah. Okay. So like, I guess to an extent you lived this, no?
Absolutely.
And so
I've lived it. So I talk from experience as well as a psychologist.
Yes. So what would you, from a personal standpoint, what have you learned about this through the whole process and now being married on the other side?
Yeah. You know, I think I am so glad that I personally put in my own personal work to be able to be where I am today. Yeah. Because my husband is amazing. He is so many answers to my prayers. He is so wonderful. And I would have missed out on this many times over if I hadn't done a lot of hard work and inner healing on myself and been like, I'm actually not going to compromise. Yeah. Not in well, let me finish my thought and then I'll caveat it. But, you know, so I was kind of like, okay, I have a vision. This is the vision that I want. I also come from a broken family. I come from a divorced family. I've seen a lot of broken relationships around me, and I've seen the profound loneliness of an unhealthy marriage and relationship. And I was like, I refuse to be that. I don't want that. So if I have to be single for the rest of my life, how do I actually build a life that I love, that I'll be really jazzed about, even if I don't have a partner? And a partner will be a cherry on top. That's of course a desire of my heart, but I'm going to invest in my friendships and my relationships. I'm not going to wait on taking that trip and doing that thing. You know, I feel like a lot of people wait and think their life is going to start when they're partnered or married, and your life is passing you by. You know, you are just as worthy and valuable as you are right now, whether you're partnered or not, right? Yeah. And so I think that, you know, I think that was a large part of my journey and about investing in building in my own sense of self and self-worth so that I wasn't afraid to necessarily take risks. I wasn't also fazed if I was rejected. Yeah, of course it hurts, but it doesn't crumble me, right? I don't crumble at the thought of it. And so I think that, and on top of that, when I said kind of like I have a vision that I'm not going to compromise on, I think through that own personal work, I was also able to put that vision in the right place, right? I think a lot of people are also very stringent with their rules when it comes to dating. They're like, I hear these girls are like, well, if he's under 6 foot, I'm not going to date him. And I'm like,
that's a big thing.
and I'm like, I'm sorry, then you deserve to be single. I'm sorry. But you are passing over an amazing man who has integrity, who's going to treat you well because he's 5'8". Like, who do you think you are? Sorry, it gets me really angry. Yeah. But, and for guys who are like, oh, she's not young or hot enough. And it's like, and it's like, it's okay to want these things, but they can't be your number ones. Right? Like, what is actually the foundation? And so I think that doing personal work can also help you tap into, I actually want someone who's kind. I want someone who's generous. I want someone who is still a good version of himself when bad things happen. How does he talk to me when he's mad at me, right? Yeah. All these different things. And so I was also in a position where I was more open than I'd ever been in terms of what my husband was going to look like. Yeah. And my husband he's objectively a very handsome man, but he wasn't what I quote unquote typically went for. Yeah. So when I'd met him actually many years ago, I was like, nah. And then a friend of ours suggested us going out, and I was at a point where I was like, I actually care more about the character of a person than so many other things that I used to care about a lot more. And I think that had a lot to do with inner healing and inner work. And as a result, I've actually been able to receive a gift that is exactly what is right for me. Yeah. That I wouldn't have recognized otherwise.
Yeah, I mean, I think you're speaking a lot of truth. I think people might be listening. There's what we know to be true, and there's reality, and then there's like the circumstances in the world that we're living in and having to deal with that. And so did you, I mean, and what I mean by that is like, did you feel the social ramifications and the biological clock ramping up because like people are like, oh, 35 now, okay, 40s in 5 years. 45. And I think that, unfortunately, this is a harder thing for women than men. Absolutely. Because men, I think, could, in some senses, get away with, oh, okay, I'm 45 now. I want to get married now.
Timeline. They do. When it comes to things like that.
But there's like an anxiety and nervousness. Yeah. So were you like prepared to be like, okay, I'm not going to settle. 40 might and accept that future potentially. 40 might come, 45 might come. Obviously, it didn't happen to you, but
Yeah, that's absolutely, it's not easy, but I think that my faith was a huge part of that. That's why I think having faith is something that's such a gift and is so important, because if I didn't believe in a God who was good, in a God who had good gifts for me, in a God who had the best for me, whatever that looked like, then it would have been a lot. It was still stressful and it was still anxiety provoking because I'm human, but I think I would have operated out of that place of fear and anxiety as opposed to a place of faith and trust, right? And hope that even if I don't meet someone till I'm 45 and 50 and maybe I don't have a biological child, all these different things that you think about, maybe I'm not as desirable because I'm older, all of that stuff was in the background, but because I have a faith in a God who's got my back and who wants good things for me, I was able to not operate out of that fear place. Yeah.
Yeah. I mean, what you're talking about, like acceptance, like there's things that we don't want to accept, but we have to. We have to accept that is like the case, and you can't force your control on something that like there's like an illusion of control that we have, and the only thing that could really force is compromising in that sense. And I think that's kind of where like it segues in kind of where I want to land, because in having your practice for all these years, like what role, because you mentioned God, which is like more of an existential big belief of like, do I believe in God or I don't believe in God, like who is God or whatever. And so like, what role do you think like how we see the world and like how we make sense of reality has like on our mental health?
I'm a big proponent of my patients finding faith, whatever that looks like, because if, I think that, as you said, radical acceptance, or being able to accept a circumstance and actually hold on to hope despite it, is hugely important to be able to navigate the world, your life, in a way where you're operating out of your values as opposed to reacting out of anxiety and fear, right? If you have an ultimate belief that the universe, God, is for me, that whatever happens is actually going to be for my good in the long run, and that I have a source of strength that is going to help me get through this, it's going to help you with your resilience. It's going to help you face hard things. It's also a place where you can, find truth and find reality, and because ultimately we've been talking about what's truth, right?
Yeah.
And it's not something that, you can, ultimately what truth is what you choose it to be.
Yeah.
That's just it. And so do you choose to believe what God says about the world? Do you choose to believe that? Or do you choose to believe, something else, right? And so being able to have faith in something at least gives you a framework where you're able to have a beautiful, healthy view of reality and operate out of that place.
Yeah.
And also, in terms of faith, it also provides things that we've talked about in terms of things like community, things like presence and mindfulness when it comes to rituals and prayers and all that kind of stuff. It's actually structured to give you so many healthy things that you need to live a healthy life. So
yeah. Well, I think when it comes to our culture, I think we're in a moment where it's just like people are sometimes at fault to just like we I don't know on the God question, and he either is or isn't. Like we could say like well I don't know, and that could be like what you feel in the moment, but like at the end of the day, it's like there is a God or there isn't. It's like a yes or no question, and so like it's a faith in that, and then like what that looks like. And I think what's fascinating about the God conversation is, studies have shown that a sense of meaning is more important for our overall happiness, and is more important for our well-being than happiness. And that's like really important, because like how we make sense of the things that happen to us and our reality, determines like our well-being. Absolutely. And if we feel like there's a complete purposelessness to I'm 40 and single, or I'm 45 and single, or whatever, and it makes it like harder to deal with.
Absolutely, yeah.
So,
and that's why often the question that I ask when people are like, oh, but am I deluding myself? And I'm like, well, is this helpful or is this not helpful, right? The proof is in the pie.
Yeah.
And so I think that's also a very important aspect when it's like, when you can't get out of that, is it true, is it not true? It's like, okay, but what's actually going to help you live a healthy, joyful, purposeful, productive life, right?
Do you see like a lot of people that are like, I don't know, working through more existential questions like in therapy?
Yeah, sure.
Is that like a common, or one of the more like, how does that interact with a lot of people's issues?
I don't know if it's very common. I mean, I think recently, because we've had a shakeup, I think, in the Western church for many reasons, and people are experiencing a lot of church hurt and questioning a lot of kind of the not only faith, but also kind of the structures of faith that we've operated in for so long. I think I see a lot more of that, and so there's been an uptick in that, but I think it takes a particular kind of person to really engage with the existential questions. What I see more is people avoiding it because because it's something that's really hard to confront. Because if it's like, okay, if I actually do believe there's something out there, am I doing anything about it?
Yeah.
If I'm not, there's a tension and a dissonance there that is too uncomfortable for me.
Yeah.
Right? And so I think a lot of people avoid it because because also they don't feel like they have, most of the population I see is younger, so they're not actually confronted with the fact that you are going to die someday. And I think I think it's not an easy question. So I think it takes a particular type of personality to really wrestle with that. And so a lot of people avoid it.
Yeah, I mean, it's more, if you want to look at it a top-down approach, like that big question then kind of knowingly or unknowingly influences a lot of like your day-to-day decisions. Or if you want to look at it from bottom up, like in terms of like a foundation, it's like if that's not there, then your life is going to look like completely different. And obviously, like people are all on their own journey of like making sense of those things, but like obviously like that is a big thing to work through when it comes to like making sense of like your mental health and meaning and stuff. I think another kind of mental health hack, if you will, is like also understanding what you said before of the mind-body like connection. And so are there any recommendations that you give to people in terms of like, exercise, eating, like all of that stuff when it comes to like that being an influencer in like mental health?
Oh yeah, I talk about it all the time, and it's very unsexy because people want like a cool guru revelation to make all my problems go away. And I'm like, you eat garbage and you sleep 4 hours a night. No wonder you're depressed, right? And it's like, and so the foundations of physical health will impact your mental health. It just goes without saying. And so if you are not sleeping enough, if you are not moving your body in any way, if you are eating garbage all the time, people roll their eyes because they're like, ugh, this is like annoying basic stuff, but it's actually the basics that really help, And so I have a lot of patients where we kind of talk about the importance of sleep and sleep hygiene, and what that looks like and how many hours you need, and the quality of sleep. And it really radically impacts. They're like, wow, I actually feel a lot better. We talk about people who smoke weed, quitting over drinking, and how both of those actually really impact your anxiety levels in a significant way. And so people don't want to give these things up. Even with the sleep thing, we're in, we happen to be in New York City where there's a lot of young professionals. It's a city that never sleeps. You work hard, you play hard. You also work so much that, I'm sure you've heard the term revenge bedtime procrastination, where people get home at a long.
I don't want to go to bed now.
Yeah, because they're like, my day was not my own. I had no time to myself. I want to do what I want to do. And so then you're watching shows or playing video games until 1 a.m. And then you're getting 3 hours of sleep and you have to get up and go to work the next day, right?
Yeah.
So, so those are kind of things I start with, honestly, with a lot of my patients, is checking in on those foundational things about your sleeping, exercise. It's just a fact that it is a natural antidepressant.
Yeah.
It's just a fact that people who exercise on a regular basis, it really does help and improve. And this is, the average person. There's some people who have like very intense mental health issues, and so I'm not negating that. But for the average person, if you were to actually regularly exercise, you will see an improvement in your mood, right? And even kind of the foods that you eat, And what's awesome is that in the age of online and social media is that you have so many resources out there to actually help you make healthier decisions.
Yeah, that's good.
And so taking care of your body is going to be completely impactful on your mind and vice versa.
Yeah, and I think what I love about like just kind of closing the loop on mental health in general is just like the we can't really approach it with like this reductionist like attitude of like there are a lot of different things that we talked about today, like the mental disorders and diagnoses and attachment, and we talked about like loneliness and like having community earlier and meaning and different things like that. And so I think like just circling back on the idea of like self-awareness and like understanding yourself is like what are you dealing with? Like what are you personally dealing with? And understanding those variables at play, I think could offer like a lot of hope to just anybody in terms of like where they're at right now, and that there's a pathway to like improving your mental health, improving your relationships and the way that you see the world. So
there's always hope.